There's a new study out tonight on marijuana use in New Jersey. CBS 2's Meg Baker reports on the possible impact of pot on retail sales on children.
Usage overall in New Jersey is lower than the U.S. average, but a scary statistic shows younger people are using more now than ever.
Marijuana usage among those 12 to 17-year-olds is actually going up, which really, that resonates in terms of we need to be more proactive. If the rate is already going up, what are we going to do now that recreational marijuana is legalized?
Charles Meanyfield is the dean of Rutgers University Newark School of Public Affairs and the study's principal investigator, looking at the impact of legalization and identifying disparities among different communities.
Both in terms of public safety, education, and health. There's no question, based on our finding, that African Americans could be disproportionately impacted in a negative way when cannabis retail sales actually begin.
He says the likelihood that retail outlets will be in communities of color is high. Data indicates that racial differences in school discipline could be linked to marijuana usage.
Black youths were suspended at a rate that was more than twice any other group. Substance abuse was the third highest reason for infractions, followed right behind bullying and intimidation.
The report is a baseline of where the state is now. Meanyfield says annual research is needed to connect the dots between where marijuana usage is highest and how legalization and the potential for increased usage will affect those communities, especially teens.
We're #1 in graduation rates right now in terms of having a good one. What we're saying is it could affect graduation rates because kids are now getting high instead of studying.
Meanyfield says a lot of focus has been on the revenue the marijuana business will bring to the state. He suggests a percentage of that should go towards prevention education and more research like this. In New Jersey, Meg Baker, CBS 2 News.